YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In this video, we are going to talk about NDT technique, also called as Neuro Developmental technique or else Bobath technique. So, if your child is suffering from cerebral palsy, autism, Down syndrome, or else if you are an adult suffering from stroke, Parkinson's disease, multiple sclerosis, any these kind of neuromuscular disorder, I'm pretty sure you must have heard this term neurodevelopmental technique from your physiotherapist. So, what is this neurodevelopmental technique and how it can help you? We are going to understand that in today's video. So, make sure to watch this video till the end. Let's begin. Neurodevelopmental technique is one of the technique which is very commonly used not only among physiotherapists but also among occupational therapists and speech therapists. This is basically a hands-on approach that is aimed towards improving function, improving movements in people who are suffering from various neuromuscular disorder like cerebral palsy, Parkinson's disease, stroke, autism, Down syndrome, etc. This technique was founded by a German physiotherapist named Mrs. Berta Bobath and her husband, Mr. Karl Bobath. This particular therapy is based on certain principles, and these principles forms the foundation of any exercise that is being given to the patient. So if you understand the foundation or else if you understand the principles behind this therapy, you will be able to understand what are the benefits of Bobath technique or else NDT technique. So let's begin first by seeing these principles of NDT therapy. So the first principle is it is impossible to impose a normal movement pattern over an abnormal hardwired movement pattern. Every individual has certain movement patterns which are hardwired in our brain. But in pathological condition like cerebral palsy, etc., these wirings are altered due to damage. So the pattern itself that is stored in brain are not normal, due to which what happens is when a movement needs to be performed, certain group of muscles have to relax and certain group of muscles have to contract. But in pathological condition, both this group of muscles contract simultaneously. And when this happens, normal movement pattern is just not possible. And when this right contraction and relaxation is not happening, no matter how much you try to impose normal movement pattern, that won't happen. That's the first principle, underlying principle behind NDT. Let's move on to the second principle of NDT, which is we do not learn a movement, but we learn how a movement feels like. What do I mean by that? Our bodies are constantly learning new things. Kids constantly learn new things. Kids never learn thinking that, okay, leg needs to be moved in this way or else leg has to go in this direction. I have to turn it in this way. No. What we learn actually is how a movement feels. Like whenever you are trying to lift your leg and move forward, how that movement normally feels. You feel movement from your hip, from your knee, from your ankle, right? So that you feel movement from your shoulders and then your elbow, then your wrist and then your finger. So whenever a movement is being done, you feel that normal sensation of strength or as power coming from the center and going towards periphery. That's the normal sensory pattern. That's why whenever we are learning a movement, we need to learn how a movement feels. The movement should feel coordinated. The movement should feel in sync. The movement should feel in one direction. So whenever we are trying to teach a patient, we have to teach them that sensation or the feeling of the movement. Coming to the third principle of Bobath technique, and that is inhibitory control. There are certain reflexes with which we are born. These reflexes gradually disappear with time. And these reflexes are also very important builders or as guide providers for our body to develop posture patterns, movement patterns in future. These reflexes, when trained in a right way and when inhibited at right time, allows a person to develop a movement in a better way. That means When a child continuously shows the presence of some reflex patterns, these needs to be inhibited at right moment of time. This can be done by introducing various posture and certain group of posture at a consistent period of time. Unfortunately, this is only possible if the therapy has started at an early age. Because if the therapist gets to see a child or treat the child at a late time, he loses the time and the opportunity to give that feeling of inhibitory positions, which forms the building block of movement in future. When a child or as a baby is early, he can be put in various series of postures on a regular basis. These postures will allow the child development of control of movements, which is not possible later in life. And that's why NDT strongly believes in early intervention for any kind of neurological disorder. Coming to the next principle, that is inhibition combined with stimulation and facilitation. Now, whenever there is neuromuscular disorder, there is a lack of coordination between muscles. That's why some muscles are overactive, some muscles are not active at all, and some muscles are not just working in sync. So, the goal of NDT therapy is to first identify which muscles are overactive or hyperactive, which muscles are less active, and another group of muscle, that is how they are not coordinated with each other. And after identification of those things, certain group of muscles needs to be inhibited. Certain muscle groups needs to be facilitated or stimulated. And then later on, these muscle groups should be trained to work together in coordination and with harmony. The next principle is dynamic treatment from the control of key points. Yes, this is a very important and interesting principle. What does it say is, if you are having any kind of movement related issues where you are not able to coordinate a movement, you are not able to do a movement, if you are able to identify certain key points in the body which forms the force producing key points, if from there guidance is provided, then a patient or as a person can easily perform the movement. For example, if a child is having difficulty in grasping an object, right? So the movement basically starts from the center, especially on the shoulder. So the first task that the child needs to do is to raise the arm, okay? So this is the place where if a dynamic support is given in a guided direction, the child will get an idea that, okay, I need to move in this way. So this guided direction helps a lot for the patient to identify which group of muscles needs to be activated in a simultaneous way. There are always key points of control in our body. Mostly these key points are light proximally, which means towards the center. So towards your core, your neck region, your upper back region, your lower back region. So these are control centers from where all the movements are being generated. So if you are able to give some support and some control guidance in the center of your body, gradually the body learns and adapts to do movement in the right sequence. Hence, body always needs to be facilitated in right direction. Moving to the next principle, and that is treatment in functional situation. Every therapy or treatment that you do from a physiotherapist, occupational therapist, or your speech therapist, it's very important that those learnings needs to be implemented in day-to-day life. If whatever you are learning at a therapy center or is from your therapist, if you are not able to implement those things in your day-to-day chores, then exercises have no use. That's why the exercises have to be functional, designed in a way that it fulfills the functional needs of the patient, and also it should be easy to understand, at least by the parents or from the patient, that he can use those learnings in the day-to-day task. Moving to the next principle, and that is participation of parents or his family members or caregivers. Never ever rehabilitation is possible by one person alone. Whenever you do your rehab process in collaboration, you will see faster and better results. Your physiotherapist, your parent, or your caregiver are the key members of the team. Whenever they are working together in coordination to each other, the goals are going to be better. always. With the involvement of parents and caregiver, there is better chance of obtaining near normal control of our body, avoiding frustration. Many times I have observed that parents are overwhelmed, they want to help their child, but they don't know how they can help the child. But when a therapist is working in collaboration with the parents and caregiver, great amount of positive outcomes can be achieved. And the sixth principle is the team approach. It's very important that whenever the treatment is done for neuromuscular disorders or any kind of disorders like CP, stroke, etc., having a multidisciplinary team is very important. It allows to develop better goals, faster outcomes, and effective outcomes. So keeping these principles in mind, NDT therapy is designed. So how does NDT therapy help? What are the benefits of it? Let's have a look. The first and foremost, it improves and helps in development of movement control. At the end, any neuromuscular disorder, the problem is with the ability to do movements in a controlled way. The movements are not normal, are not sequential, are not in harmony. And the aim of NDT technique is to help achieve that. So that's the foremost important benefit of NDT. The second important goal or benefit is development of new movement pattern. As I already mentioned that the problem in stroke, cerebral palsy or any kind of neuromuscular disorder is an abnormal movement patterns that are present. The aim of NDT is to break down these movement patterns and help to develop new movement patterns that are normal or near normal, so that these get wired inside the brain reorganizes and develop new movement patterns which are very helpful and effective. The third benefit is it activates the sensory system. As also I mentioned in the previous principle, that everything or as every movement that we learn or as we do is dependent on how the movement feels like, how the movement is happening. We are not observant of movement always. We don't use our eyes to see our movement. But how do we know that we are doing the movements in the right way? The movement should feel right. Everything should feel right, should feel normal, and should feel in harmony and synchronicity. And that is only possible with the help of good active sensory system. And NDT focuses on development and activation of sensory system. So if your sensory system are well active, well coordinated, it helps you to achieve better result. Next benefit of this principle or therapy is it not only helps in achieving motor control, but it helps in overall development of a human being or else a child. Be it physical development, mental or cognitive development, perceptual development, or even emotional development. See, remember, if your movement feels right, you feel good, you feel confident, you are not scared, you are not anxious. So NDT helps you to achieve all of that. But there are few myths, confusion regarding this technique. So I would like to demyth that, and I would like to tell you some of the important facts or important information about this technique. First itself, it's not a technique, it's a concept. NDT is a concept. Bobath is a concept. It's not a method or else it's a technique. So if you ask me that, okay ma'am, tell me what is an NDT exercise, there is no special different kind of NDT exercise because it's a concept based on which a movement or else an exercise pattern is designed. The second fact about NDT or else Bobath concept is it believes in neuroplasticity. The aim of entire concept of NDT or else Bobath is to help develop a new pattern inside the brain. It aims to reorganize the brain in different way that is near normal and that can help person achieve near normal. It also believes that neurodisability or its disabilities related to neuromuscular disorder have the potential to improve consistently throughout the lifetime. So it's not just the age that if you are young or is it just the 5 years of time frame in which you can get better, but you can constantly get better in your ability to move till the time you are alive. Next principle is the focus on enhanced functional skill. At the end, every exercise that's given on the basis of this principle or this concept is to improve the functional ability of a person. And the last important fact about this is it's a multidisciplinary approach, it's a team approach. So for this, you cannot just rely on one person, but you need multiple person from different subjects who needs to collaborate here, including parents and caregivers. When they all collaborate together, then only this concept can come into picture. So through this video, I hope I was able to make you understand that what is NDT at the end, what exactly it is, and how it helps. I hope you found this video helpful. If yes, make sure to like this video, share this video, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.